Dr. Frank Mills was a 34-year-old obstetrics resident who had lived most of his life near his parents in Richmond, California. Recently, he had moved to Miami, where he lived in a 3-bedroom house with a pool and spent weekends hosting small parties and barbecues. Dr. Mills was friendly and charming, but could sometimes come across as arrogant and boastful. He enjoyed medicine, but his real passions in life were cooking, surfing, and ping pong, in that order. It was another night in the maternity unit. In front of the coffee machine, Dr. Mills was talking with his colleague, Dr. Holt, about a party he was planning for the 4th of July. A few moments later, a nurse approached him and said, "Dr. Mills, we have a 37-year-old woman who's 39 weeks pregnant and hypertensive." Dr. Mills said he'd be there in a moment and then resumed his conversation with Dr. Holt. "So, what do you say? You should come by on Saturday night. It's going to be the best 4th of July ever." He smiled and went to see the patient. "Hello there. My name is Dr. Mills. What seems to be the problem?" he asked the frightened woman. The woman explained that over the past few days she's been having blurry vision, a pounding headache, and feeling more anxious. She was spending the weekend with family and thought the symptoms were from being sleep-deprived. She didn't want to worry her parents, so she waited until today to check her blood pressure back at her home. Normally, her blood pressure was around 120/80, but today it was 155/100. She knew that she was supposed to call if that happened, so she called and was told to come in. Dr. Mills calmed her down and explained the plan. "We'll be admitting you to the hospital and doing some lab tests to make sure that you and the baby are safe." The woman agreed. The initial lab work showed that there was protein in her urine, evidence of preeclampsia. A non-stress test was done to assess the fetus, and it was reassuring. About 8 hours later, the woman's condition worsened. She was having more swelling and had more protein in her urine as well, all signs of preeclampsia. On top of that, she had begun to have vaginal bleeding. Dr. Mills ordered another non-stress test, and this time it wasn't normal. Abnormal fetal strip, heavy vaginal bleeding, preeclampsia. This patient needs an urgent delivery, Dr. Mills thought aloud. Transfer her to the labor and delivery unit, and let's induce her labor with oxytocin. The nursing team, with many more years of experience, disagreed unanimously. This woman may be having a placental abruption and needs an immediate C-section. The nursing team wanted to involve the overnight attending, but Dr. Mills felt like he could handle the situation without additional help. He suggested setting up continuous fetal heart monitors, and the initial tracing showed that the fetal heart was returning to normal. Dr. Mills felt triumphant and initiated intravenous oxytocin to induce the labor. Unfortunately, within an hour, the fetal heart rate became abnormal again, and the woman began having worsening abdominal and back pain. At that point, Dr. Mills proceeded to have the woman undergo a C-section. Over the ensuing weeks, it became clear that the baby had sustained severe brain damage in the form of hypoxic ischemic encephalopathy.